We had a question from one of our registrants from our Bali event regarding the dorsal scapular nerve. We thought we'd just answer that. So it was about a diagnostic block, where to go, what to look for. So our dorsal scapular nerve is a branch of our C5. It generally pierces our middle scalene. Bit of tiger country up there. We don't like to get too involved there, but what it does is it will course posterior under a levator scapula and rhomboids and also innervate these muscles. Now, this nerve can undergo a stretch injury, but most of the time when we're looking for these strange medial scapular ache, discomfort that we get, and we're thinking maybe there's dorsal scapular involvement, what we want to do is do a little block on this nerve just as it's coming right next to that medial scapular upper border, so just where it's coming under the levator scapula and rhomboid. So we're going to show you that. These patients that we're looking for this generally have a little bit of scapular dyskinesis. They'll have a bit of a catchy, clicky scapula where it's rolling over a rib and catching that little fatty triangle that this suprascapular, dorsal scapular neurovascular bundle run. So we're going to show you where to look for that and how to inject it. So when we're assessing our dorsal scapular nerve, what we want to do is we want to feel for that medial scapular border upper, and we'll just pop our probe on there. Just going to flip that around so I don't get myself confused. So we have our trapezius and our rhomboid here. If we come up our rhomboid, we get our levator scapulae forming right next to it there. So we'll come down, and it's just down in this little fatty triangle. Now we can see an artery pulsing away there. That's our dorsal scapular artery, and our nerve should be sitting just medial to that. So we'll have our artery here and our nerve just sitting next door. So this is a great spot to try a little diagnostic block for those with recalcitrant pain along that medial scapular border. Obviously we can't approach from a lateral approach, so it's a medial approach, and it's hitting into this tissue plane here. So just going deep to our rhomboids and injecting in here. And you don't need a lot of local anaesthetic to do a block here, but it's pretty simple to do a little block on that. What they might find is a bit of weakness in the rhomboid after that, and there might be a little bit of scapular winging with that. But what we'll find is if the dorsal scapular ache is caused by this nerve, this is where we'll treat it to see if we can get some symptom relief for them. So one thing to mention is when we're lining up to do these injections is we want to be careful about our pleura sitting deep here. So here's our rib. Here's our pleura. We can see when Dan takes a big breath in and out, we can see the movement. So what we want to do is when we're lining it up, we want to have our artery and nerve sitting over the top of a rib, just so we don't risk going deep. So we'll line it up over the rib, come on in, and just sit in on this surface. Quite often it's easier just to go a little deeper and start coming back as you inject, and you'll find you'll hit that tissue plane really nicely.